My prediction for 2019 is greater community acceptance of harm reduction. We're all used to harm reduction. We use it every day because we wear seatbelts and we wear helmets when we ride bikes. But I think in health promotion we're seeing greater community acceptance of it now, really underpinning the discussion with pill testing and also debates about safe drug consumption rooms. So it's coming up everywhere. And with greater acceptance of harm reduction as a concept comes increasing challenges for communicators because it gets complicated. You've got to try and explain relative risk, and you've got to try and encourage people to leave behind some of their preconceptions and to focus more on what can be done rather than how they'd like to see things be.
My prediction for 2019 is a closer integration between social media and e-commerce. So I think what we'll start to see is the consumer being able to purchase a product within a social media platform without actually having to leave the platform itself. And I think in terms of PR, what we'll see is a closer integration between sales metrics and evaluation. So really things like this only help improve the process of evaluating campaigns. So it's something to look forward to in the future.
I think in 2019 it's going to be a year full of disruption for the health sector. There's an aged care Royal Commission coming, there's a new system for digital prescriptions on the horizon, and I think the federal election will also play a big part in how companies sort of react and find their way through 2019. There'll be lots of action for issues management, but I also think there'll be a lot of exciting announcements to come as well.
Over the past couple of years, we've seen video content become more prominent across all media platforms. So for 2019, my major predictions is the ongoing rise of video content.
I think that we'll see the continued decline of very detailed evaluation reports. I think that clients and agencies alike have a growing appetite for streamlining and refining metrics to ensure that the data that is being supplied at the end of a campaign is hard-hitting and most meaningful to their broader corporate objectives.
In 2019, I think a lot more people are going to get their health services delivered to them digitally. So whether that's through their smartwatches or apps on their phone, people are now booking doctor's appointments, tracking their health, and making health decisions using the information on their devices. There's a lot of companies emerging in this space that I think people in the PR industry need to be watching as potential clients, and then as well using their models in other spaces.
Storytelling will continue to play a really big role in PR this year. However, rather than putting so much energy and focus into just media relations, we will look at different ways to share powerful stories. There will be greater use of podcasts and creating really visual content for mobile devices, and that way we can have far more targeted, meaningful conversations with our target audience.